I'm Malcolm Wilson and I'm one of the consultants that helps run the Peritoneal Tumour Service here at the Christie Hospital. We've been doing cytoreductive surgery with heated intraperitoneal chemotherapy at the Christie since 2002, and since that time we've done nearly 800 patients with this procedure. The purpose of doing it is to basically remove disease that's sitting within the lining of the abdomen. It's a specialist procedure and there are only 2 units in the country that do this procedure. Our results are comparable to the best units in the world. So the purpose of this treatment is to deal with patients who develop tumours in the inner lining of their abdomen, what's called the peritoneum. One can imagine that that's a bit like thinking of a room and the disease is sitting on the surfaces of the walls, the ceiling and the floor. The cytoreductive surgery, the basic principle of that is to remove this surface disease, and what we aim to do is to completely remove all of it, and that's what we term a complete cytoreduction. If we're able to do that, we then follow that up during the same procedure with this heated chemotherapy wash, which is called HIPEC. The purpose of that is to kill any of the residual cells that sit within the abdominal cavity that can't be seen, to stop it coming back. We know that this approach works extremely well for patients with this condition called pseudomyxoma or PMP. About 85% of patients who undergo a complete cytoreduction with the HIPEC will go on to be long-term survivors.
My name's Paul Fulford. I'm a consultant colorectal surgeon. I work here at the Christie and have been here since 2003. In terms of selecting patients for cytoreductive surgery in HIPEC, we discuss all patients in an MDT meeting. This is a special meeting where we have surgeons, radiologists, oncologists and pathologists. We then look at the most up-to-date scans and try and decide what is the best treatment for that patient, tailoring it to each patient. Although cytoreductive surgery is a very successful treatment, like all things there are some risks involved. Here at the Christie we have huge experience of this operation with very low complication rates when compared with other centres performing this surgery.
I think it's important to recognise the fact that we operate very much as a team. We have specialist consultants, trainee doctors, nurses, pathologists, X-ray doctors, oncologists, all of whom are experts in their field. And by bringing all of that expertise together into one unit ensures that the patient gets the best possible result.
Hi, I'm Judy Eccleshaw, I'm 60 years of age. I was diagnosed with pseudomyxoma peritoni in 2004, and I had my major surgery at the Christie for cytoreductive surgery in 2007 with the HIPEC. Obviously before the surgery I'd been really worried about it, and I'd been reassured by the consultants here that there wouldn't be any issues. There weren't any issues at all, and after the surgery I thought to myself I really shouldn't have put myself through all of that worry. I'm just really pleased that I chose to have the surgery, because now 8 years on and there hasn't been any reoccurrence of the disease, and I'm just really pleased that I did make that choice of going for it. I wouldn't have chosen any other hospital to come and have the surgery. The Christie is just an outstanding hospital. It's second to none, and if anybody wanted to have their treatment, come to the Christie. You will get the best care.